I'm joined now by Dr. Maxime Madhere of Our Lady of the Lake. Well, I knew I was going to butcher that, but it's okay. Right. Thank you for joining us here for this important conversation, especially when it comes to healthcare. So we know that the lack of access to food is a big deal, and especially in some neighborhoods. That trend is starting to change. What has been the biggest challenge to make that happen?
Oh, that's a very valuable question. Number one, I think the biggest challenge is that as a city as a whole, you need complete communication between the private sector, the public sector, and the nonprofit sector. Right? So I'm a part of an organization called the 100 Black Men of Metro Baton Rouge. And then within that organization, we have food drives occasionally, right? And then you also have other nonprofit organizations such as Healthy BR, the 3 O'Clock Project, and all these different nonprofit organizations that kind of fill in that gap in order to be able to provide access to food in these food deserts, right? But the problem is that you have a large segment of this society that doesn't necessarily value the lives of the marginalized, all right? So where you have a segment of society that doesn't feel like every area in the city is valuable, or that's where you essentially have areas of the city where there's disinvestment. Right. And it's not only present day disinvestment, this disinvestment has been for generations. And those cycles lead to contemporary issues that we have now. Yeah. So until we can get on the same page where the nonprofit can match the private sector, you'll continue to have some of these healthcare, or at least these food disparities.
Right, and we'll talk about a couple of those issues in just a minute. I want to talk about emergency care really quickly. We just saw, I believe it's been about 2 months now, give or take, that Baton Rouge General Mid-City reopened its emergency room after 5 years of being closed. How difficult was it during that time for medical staff when it came to providing emergency services in the city?
It was extremely difficult. And if you want to look at the recent history of what essentially happened for why that emergency room even shut down in the first place, that emergency room was essentially losing in excess of $2 million per month, right? And at that time, there was no local or federal funding going to that hospital. So essentially what you had was a gap of healthcare to the north side of Baton Rouge. The first institution that kind of stepped up to fill that gap was Our Lady of the Lake Regional Medical Center in 2017, where they actually put an emergency room there. That emergency room had basically 3 triage points, right? So in emergency conditions, you have emergent situations, such as your traumas, right? You have urgent situations, and then you have situations where they're non-urgent. And that building that the Our Lady of the Lake provided, it provided a situation where patients who were non-urgent or non-emergent could then essentially go down the hall to get treated for non-emergent situations, right? So that was the first thing, but it wasn't enough. What essentially happened is now you're having a scenario where, as recently, like you just stated, Baton Rouge Mid-City is able to come back. Well, why is it able to come back? Well, the reason why is because you essentially have funding again. Right. The Medicaid expansion from 2016 is providing the majority of funding that's in that area. But not only that, when you think about areas of disinvestment, you also have to have access for mental health and social services. And there's also another institution on Howell Place coming again from funding, right, that is placing the stamp in that area to say, okay, we realize that we've done a disservice to this particular community, and we're trying to do our best in order to change that narrative for that community.
And that access, that's the key word right there. That access is so important. You mentioned some things that are effects because of the grocery gap, you know, because of people not having access to healthier foods. We've seen how COVID-19 has affected blacks at a higher rate than anyone else. Hypertension, diabetes, heart disease. Those are our underlying conditions that have the highest percentage of cases here in our state. This wasn't anything new, but why is this showing basically I guess, shining a light on this.
Yeah, I would just piggyback what you said. It's not anything new.
Right.
Again, and it all ties in. There's not one segment of society which isn't tied into the other, right? So the food deserts that we spoke about, right? The continuous generational disinvestment in these communities, they basically amplified problems that we know that already existed. Right, so the most important part when you talk about hypertension, diabetes, and obesity, there's a disconnect there, and it's multifaceted. One is a disconnect from, again, a historical perspective where communities of color have a genuine mistrust for the predominant society. Medicine in itself, and I tell people this all the time, medicine in itself is essentially a microcosm of what we see in society. There's definitely racism in medicine, all right? So you can meet any physician of color and they'll clearly identify with similar experiences that happen within the medical facility, right? Care providers who don't necessarily take the best care of patients who come from impoverished neighborhoods. So there's a disconnect between the care provider-patient relationship, all right? And then that also leads to education. If you tell somebody who's never had access to fresh foods, to things such as smoothies, Brussels sprouts, greens. These things have to be implanted into children at a very early age in order for those children to grow into healthy adults. So healthy lifestyle, that's exactly what it is, a lifestyle, right? So, and then when you add into the socioeconomic conditions, even if you put, I'll give you an example. Let's say if you place a Whole Foods in the middle of the Plank Road corridor, right? If that Whole Foods is in that area, how are those people where the average salary for people in Louisiana is $40,000 or less, and most of those people in that area live below the poverty level? They can't even afford anything in the Whole Foods corridor, right? So those issues are multifaceted, and you have to address it in an entire whole ethos approach in order to change the narrative on that.
You mentioned about racism within the medical field, and something that I read was how there's a slow push to get the way training is done changed, because when it comes to, in your studies in medical school, when it comes to skin, you only see white skin. What's up with that?
Well, again, that goes into education. Education, you can't separate the education from the social conditions or medical school training, right? The majority of, what people don't realize is that African Americans only make up 5% or less of the physician workforce, right? So, and that number, particularly for black men, we only make up less than 3% of the physician workforce. And that number essentially hasn't changed since the mid-1970s. And so when we talk about why haven't those numbers changed, it's because the majority of students who are coming into the medical field, the majority of them are coming from disadvantaged schools, right? Again, it's the same question about leading to access. And we actually see it, if we're being quite frank and honest, we see it right here in Baton Rouge, right? The areas that have the most disinvestment have the highest crime rates, have the least access to adequate health care, right? And also have the lowest performing schools. And when you look at that, and then you look at the other side of town, and then you see private schools, private funding, and the best access to the resources, it's not rocket science as to why that you have such a disproportionate number of African Americans in the medical field.
Right, definitely. One more question for you. What can be done now with our children to ensure they don't develop any of these health conditions? You kind of touched on it, but it's not so simple, but it takes some work.
It does take some work, and you know what? I liken it. I wish I had a direct answer for you, but just like COVID-19 has amplified the societal issues, I think you see exactly what's going on right now. I wish I could say our kids are going to be completely protected, but unfortunately, we even see the funding of the financial resources are going to certain school districts. This is across the country, but this is also in Baton Rouge, right? You can do a study and you can see when we talk about equality versus equity, those are two completely different things. And you can see the amount of funding that are going towards some of the more privileged schools, and then you take yourself to the north side of Baton Rouge and you see a completely different picture. And so I cannot say in those communities where there's been generational disinvestment whether or not those kids will be protected. I pray that they are. But knowing as somebody on the front lines who's seeing what's going on in the hospital, we just can't guarantee that. And that's what, that has to sit in the soul of the conscience of the nation, and it has to sit in the soul of the conscience of the community in general, right? So we all may not agree politically, right? But we know that within this particular city, you cannot have an excellent city or a highly functioning city if there are areas that you don't care about. And so those are the only, until we can get on the same page about that, and until we can agree upon, we all want to make Baton Rouge a great city. In order to do that, we have to care about the entire city, not just the area around Bluebonnet.
Yeah, you're absolutely right. Dr. Max Madhere, thank you so much for giving us this insight, especially on healthcare, and helping us continue this conversation.
Thank you very much.
All right.